We are back with our very special guests from IndyCare. We have founder Franklin Roye and frontline healthcare worker Paul Dunn, and also from Hillsborough Pharmacy, Tiffany Barber, the founder and proprietor. Thank you all for coming in, and I guess I got to ask first of all, phone's ringing off the hook. How are things going right now as far as the community and the fear factor? Are you hearing a lot from people on a daily, hourly, regular basis?
You want to take that first, Tiff?
Yeah. We our phones have been ringing off the hook mainly because people want to know if we're going to be shutting down, reducing hours, what the process is going to be for getting medicine, what we're putting in place to keep them safe, and then just a bunch of worry about, we're at a time when flu's still going around, allergy season is really, really bad, and just your general change in seasons can cause various symptoms that people might be worried that they have that. So they're calling to say, I have, a little bit of cough, but I'm not running a fever. What should I do? So there's a lot of that and triaging and making sure that we're not sending people to go get tested that don't need to be tested, or that something they can be treated over the counter, and implementing procedures. We're doing a lot of deliveries now. So.
Yep. And are people asking for medicine that is effective against coronavirus or cures, which does not exist?
No, those things have not been proven yet.
But are people asking about them?
There have been a couple of people asking about them. Some family members, unfortunately, trying to call in prescriptions for them and their family members and go ahead and get a stockpile. We are currently holding our medicines for people that have chronic illnesses or that are in desperate need of them, since these things aren't proven to do anything with COVID-19 as of yet.
Okay. And what are the steps you have taken in place for public safety purposes? You have basically restricted access to the pharmacy itself, but you're open during normal business hours. So what are you up to with that?
So, yes, we're open normal business hours as of right now, 8:30 to 6:30 Monday through Friday, and 10 to 2 on Saturday. We have restricted, no one can come into the pharmacy. That's for patient safety as well as staff safety. We are offering free delivery Monday through Friday if you live in Hillsborough. And then we're having the majority of people do curbside pickup. So a lot of people will call and pay ahead in advance. We go ahead and check them out, have everything good. They call us, and we can either bring it out to their car, or we have a table set up that you can come up to and ask for your prescription, and we can do it that way.
Tables outside?
Table is outside,
okay.
Restricting you to come, make sure you can't come in the building.
And you are sanitizing the building even though no one's in it 3 times a day?
Yes.
For extra precautions.
Mm-hmm. And plus our table and all credit cards and all of our people are wearing gloves and taking the gloves off and sanitizing each time they take someone's money or credit cards. So it's a very tedious process, and we just ask everybody to be patient with us because we're trying our best.
And how about supplies? I mean, of course, you are a regular old pharmacy. First of all, prescription medications, no slowdown as far as your ability to get them?
No, I mean, we do have some that are on back order. A lot of those medicines that were made in China or the ones that have been mentioned on TV that don't have any proof. So there's a couple things that are on back order. Luckily, we have a variety of sources we order from, and so far we have yet to have any issues getting any medicine.
Okay. And then as far as regular pharmaceutical products that are over the counter, are those still in reasonable supply, or are people stockpiling those and cleaning you out?
Yeah, so people have made a run on every day. It's something different that people make a run on. So we don't have hand sanitizer now, but we are compounding some according to the FDA guidelines in order to be able to make it safe for use. We don't have that available yet, but we're hoping to roll that out sometime today or tomorrow. We haven't had masks in forever. People are making a run on zinc. Apparently, somebody heard that zinc is good for it. At first, it was elderberry. Now there's not.
Right.
Elderberry has fallen out of favor.
Echinacea, the pulmonary stuff. Yeah. Okay.
Tons of Tylenol since the small study that said something about ibuprofen. So we've been selling Tylenol like crazy. But everything seems to be coming in at least pretty frequently. Zinc is currently our hardest thing to get, so we're kind of limiting on that. But whenever we have something that is hard to get, we're limiting supplies of how much somebody can get at once.
How about rubbing alcohol?
Oh, yeah, we don't have any of that.
None of that.
None of that.
Wow.
And now peroxide's actually been hard to get, too.
Yeah. Okay. All right. Well, that's Tiffany Barber from Hillsborough Pharmacy, located, by the way, in Boone Square on South Churton Street, side by side with IndyCare, your urgent care, affordable urgent care walk-in clinic. And you guys have also had to make some adjustments. We'll talk momentarily about the partnership that you're doing with the pharmacy for the first few rounds of determining if someone needs a COVID-19 test and some of the bottlenecks that your patients are encountering if they get that far. But what changes to your general daily service have you made so far?
Well, Bob, our focus from the beginning has been two things. One is just to be able to maintain continuity of access to care, right? Because most of the things people need out there are unrelated to COVID-19. But, it's easy for those things to be disrupted. And you may have something simple like a UTI or a pink eye that without access to care and medications can get worse and have complications. So we wanted to make sure we could maintain access, and we're doing that both in the clinic through video telemedicine visits and delivery of medications to people through the pharmacy. The second thing we focused on was how can we make sure that the limited COVID-19 testing and treatment resources that are available are used appropriately. And that's where we offer the ability to kind of screen people we have a text message service that they can use on their own to get screened, through a video visit with one of our providers, and then if they do qualify, through getting flu tests out to them through the pharmacy, so that we can rule out flu as a cause of their symptoms.
Okay. I want to get into the nuts and bolts of that in just a second, but if you have a garden variety illness, because as you say, people are still getting sick with not just flu or things that have an associated fever, but things that require urgent care or attention. You have a chest pain or you have something and you need to be seen. So you are still taking patients in the clinic as long as they don't present with fever or obvious symptoms associated with COVID-19. Is that right?
That's right. Yeah, that's
Paul,
right.
Speak to that.
Right. So if you call and have a cough or a fever, then we will send you the link so that you can see us on the screen, and we'll talk to you about what your symptoms are, do a truncated physical examination, and if we think you have something that is not respiratory, we'll bring you in. People still get broken toes or, cut themselves and so forth, but everybody's so afraid to go anywhere right now if there's a place open that they don't know what to do. So we will see them in there. The door will be locked until we admit you, and then we'll take care of you and work with the pharmacy to get you what you need if you need something. So we're still there.
So it still starts with a screening process. You either have to call or do a telemedicine visit, and then if you are deemed eligible to be seen in person, then you'll make those arrangements.
We will make them.
Okay, that's good. IndyCareHealth.com, by the way, and Hillsborough Pharmacy NC.com are the two websites that we will be talking about, and we are talking about. So then you decided, because you already had this system in place for flu called the Screw You Flu Initiative, where people would not have to come in if they thought maybe they had the flu. You could do a screening and then, if necessary, go out to their homes and provide them a flu test. Do the flu test right there, and then treat them either for flu or for whatever else they had if it wasn't the flu. So you had this infrastructure already available starting back in October?
December, I think we started.
December, the official start. So you've now simply enhanced this new platform to help with COVID-19. Pre-screening is basically what it comes down to. And one thing that's interesting is that you are finding that people are still testing positive for the flu. So we're still in the middle of flu season. The instant reaction as soon as anybody is getting a cough or a fever is like, I got COVID-19, because this is what's omnipresent now. But the flu's still with us. So the first thing you do is, if you're going to tap into this system, is get a telemedicine visit. You can go to IndyCareHealth.com. They have a special platform, telemed.IndyCareHealth.com, but you can access that from the homepage. And do a video visit. For those that are not wired up, you can do it by phone.
You can.
Okay. And then it's the same process. Someone from the pharmacy will go out and present you with a flu test. First of all, make sure that it either is or isn't the flu. If it is the flu, you get treated. If it isn't and you have COVID-19 symptoms, then what happens from your end?
Yeah, so this has evolved within the last 12 hours at the state level. So what we have been doing is we've been working really closely with the health department because, as you can imagine, their resources are stretched. And so what they don't need is people who are not qualified for testing coming and calling and trying to get testing. So we're able to qualify people through that process of the video visit, the flu testing at their home, and then we can have a qualified patient handoff to the health department for testing.
So this is really important, an important step. It's pre-screening, and once you make this determination that someone really should have a test, then you contact whoever it is, the health department or a hospital, and they trust that you have already done this. It's not like just some guy saying, I need a test.
Correct.
Now that's all right. So, and how has this been going so far? How many people are you doing telemedicine visits with? I imagine it's ramping up a little bit.
Yeah, it's increasing daily. One of the things that we've done is, this is a unique ability, I think, of a collaborative entity like IndyCare and Hillsborough Pharmacy to combine their services and to be able to offer this. But we do realize that there's a lot of people, within Orange County even, that we can't reach through just Hillsborough Pharmacy alone. So we are expanding this and working with other independent pharmacies in the county who will provide that last mile of care part of the collaboration. So they'll deliver medications and the flu testing to the patient's home in other areas of the county like Carrboro and Chapel Hill and even down to Pittsboro through some of the other pharmacies we're working with. So it's going really well. Overwhelmingly, most people will get through that screening process without the need for COVID-19 testing. We have had a couple that we've recommended for testing. We've handed them off to the Orange County Health Department here, and they've gotten them the testing. In some cases, they do it themselves in-house, and in other cases, they've sent the patient over to UNC. Testing center to be tested.
Okay. Well, there are some issues we have heard about. Duke has a telemedicine pre-screening program now in place, but apparently if you call it, you need to be prepared to wait for several hours to actually get someone on your line who can then screen you. How long has the wait been for you guys? Have people stacked up waiting for an appointment, a telemedicine appointment?
So far, no. There hasn't been a wait. Again, we do two different things. So one is with the text message system, which is on our website, you can access that instantly. And that will filter out a lot of people who are just concerned but simply don't meet any criteria of risk. If you are at risk, it will then direct you to the telemedicine visit. And with telemedicine, you can just book an appointment for today, for tomorrow, for this afternoon. And so you'll have that dedicated time for you for your screening and evaluation. And we haven't had issues with not being able to meet demand.
Okay. Now, things are fast moving. As we have noted, there is a changing situation on the ground at hospitals. You've mentioned when we were off mic about some problems with the testing protocols because people who want tests but maybe didn't need them are standing with people who do need them or maybe COVID-19 positive, and the risk of transmission is higher in that case. There's other issues, the lack of testing kits, and then the turnaround time can be 4 or 5 days, and this is a situation that could get a lot worse. Are you doing anything in anticipation of increasing numbers here in Hillsborough or in Orange County?
We're primarily just trying to stay up with the people who do call and get on the case right away and don't put them. We're trying not to put people into lists. We're trying to deal with it right as they come in, and right now we can do that. But, I mean, no question, if we find out that Orange County now has 30 cases instead of 4 cases, or 6 cases.
6, yes.
Then the anxiety is going to go up and people are going to start calling more and more, which means we have to deal with that just like Duke or UNC does. They have a bigger population to deal with. So we're going to do the best that we can, and we're going to do it as quickly as we can. And we're asking people to be as patient as possible, but there's just so much patience people have when they're sick.
Now, you have 2 qualified healthcare staffers. 3 now, okay.
3.
So you have the ability to ramp up a little bit your capacity. Any possibility of doing that even more? Are you looking at that? Should this become something that is necessary? Should the demand for your services exceed the available capacity of IndyCare?
Yeah, we are. I mean, that's one of the good things about telemedicine is you're not constrained by space physically. So we can have multiple providers potentially available at the same time, managing telemedicine appointments. So it's actually a lot easier for us to ramp up our capacity on telemedicine than it is physically in the clinic.
Well, it must be, one of the things that's really important about what you guys are doing is that the quick response going out to people's homes and the fact that most of the people who are concerned about this do not qualify for COVID-19 testing, there's a huge relief factor that they must experience, even if they only have the flu, only in quote marks, because the flu can be very, very serious as well. But there are some treatments. You provide the Tamiflu, Tiffany, I guess, if they test positive, and that test is a very quick test.
It is. It's a quick turnaround to be able to know. And a lot of times the providers know offhand before we even send the test out that it's looking like flu. And then we can always bring over-the-counter medicine as well to help with the symptoms of that. If it turns out you don't have the flu, but you have a cough, a cold, or just an allergy issue. I mean, we're seeing a lot of healthcare buildings and a lot of doctors' offices and even urgent cares that are shutting down facilities to their patients only. They're pre-screening for fevers, and if you have a fever, you can't come in.
Right.
But I mean, there's tons of people out there who need urgent care. They may have a fever because they have an ear infection or strep throat or a sinus infection. And then there's people who may have cuts or urinary tract infections, and so it's so important for us to stay up on those things to be able to do that, so that way we can see those people in the clinic that need those kind of services, while still, if it happens that we continue our telemedicine and trying to triage people, that maybe a provider can do that at home while someone else is in the office treating everybody else who needs that help.
Okay, Tiffany Graham Barber with Hillsborough Pharmacy, HillsboroughPharmacyNC.com, and Franklin Roye and Paul Dunn with IndyCare. That's IndyCareHealth.com. I know I'm following along because I should make note. You support this program and this radio station, and for that we really appreciate it. This has nothing to do with that. They are completely separate. This is because this is very important information for the community, and we really appreciate what you guys are doing. This innovative collaboration between pharmacy and Frontline's healthcare providers has a lot of potential to expand, and I think other people are going to look at what you're doing as a model for care in these times. And so keep it up. Keep us posted on what's happening. If we do get an increase in numbers and people start to freak out, then let us know what you're up to, and I'll keep following along online as well.
And I think a big thing is if it ends up our cases are ramping up and we have a required shelter in place, the good thing is that we deliver. So people won't have to get out and won't have to get exposed and can stay in their house and still be able to get medicines or even over-the-counter products or even something that we carry like shampoo or something that they need so they don't have to go to the grocery store.
All right. Franklin, Paul, and Tiffany, thank you so much for joining us this morning. And we look forward to more dispatches from the front.
Thank you.
Thanks
again.